Are we going? Is there somebody? Okay, perfect. Hello, welcome to the Standing Committee on Social Development and Health, and today is December 15th, 2021. My name is Gordon McNeely. I'm the chair of this committee. With us today is Carla Bernard, Sydney McEwen, and Zach Bell at the moment, and we'll get started. But before, can I get an adoption of the agenda? Carla Bernard. Perfect. Today we're going to get a briefing on long-term care planning for shelter beds from the Department of Social Development and Housing. So I will pass it over to our guests to introduce themselves, and then they may proceed with the presentation, and we'll just kind of maybe save questions to the end. Okay, great.
So I'm Shelley Cole with the Department of Social Development and Housing. I'm the acting manager of supported housing.
Dave Keedwell, Deputy Minister of Social Development and Housing.
So I can get started?
Sure. Yeah.
Great. Okay. So my understanding of the invitation for us to appear here today is to discuss long-term planning for shelter beds. And I understand that specifically the committee is interested in hearing about current capacity, plans to increase capacity to support homeless individuals, and particularly during weather events. I understand we're interested in hearing about strategies for communicating additional spaces for those that are in need and the current process that's followed by the shelter support line. And then I'll finish up with any questions that members may have. So I would like to start by acknowledging that emergency shelter is an important part of the overall housing continuum. And it should be viewed as a part and not as an isolated service and not certainly as an endpoint. So shelter falls within the safety net component of the housing continuum. And it should also be recognized that the use of shelter supports by clients in the community should really be viewed as a temporary service, and that we are always working to support the barriers and address the barriers that are facing our clients in pursuit of long-term, sustainable, affordable housing. Client participation is required, and so I thought it would be helpful to start with an overview of the existing shelter supports. So for female identifying clients, Blooming House in Charlottetown offers 8 beds, and they are open at 4 p.m. until 8 a.m. daily. The Chief Mary Bernard Shelter in Lennox Island is a 24-hour-a-day service that supports women and children. And they actually have 12 beds in 5 rooms, so that's a little bit of a correction to the slide. But I'm just going to touch on that, as well as that Anderson House in Charlottetown has 18 beds in 6 rooms, and they are also a 24-hour-a-day support. Because both of those facilities offer support to women and children, they are not always able to support single women, and particularly not when those women are in any form of a mental health crisis or dealing with drug or alcohol use. So those 12 beds at Chief Mary Bernard and 18 beds at Anderson House also include cribs and smaller beds for children and families. So on the male side for shelter supports, Bedford McDonald House in Charlottetown has 10 beds in regular operation and has the ability to use 2 temporary beds to increase capacity to 12. That service currently opens at 4 p.m. and closes at 8 a.m. daily. And Deacon House, which was formerly operated by Health PEI and located on the grounds of Hillsborough Hospital, has moved to 35 Weymouth Street in Charlottetown and is now operating with 8 beds in service. So that's an addition of 2 men's shelter beds, and that service operates from 8 p.m. until 8 a.m. So when we think about current capacity, we are working very closely with our shelter partners to monitor shelter bed capacity, and when we need to, we add additional beds. So this includes activating the 2 extra beds at Bedford McDonald House and operating Deacon House at 8 beds every day. And it is our intention as we go forward, now that Deacon House falls under the responsibility of Social Development and Housing, to examine whether we need to add additional beds to that support. So we'll be looking at that in the coming weeks. And we receive monthly reporting as part of the contractual requirements of our shelter partners at both Bedford McDonald House and Blooming House. And now that we'll be the operator of Deacon House, we'll certainly have better access to information around that usage. And using information that's available to us through the shelter support line and regular conversations with our partners, we're always assessing when additional beds are required. So those events could be when there's a severe weather event that's coming, or when we are seeing normal, like peaks in our normal capacity. So if we're seeing some changes, we're always talking to our partners. So we're in constant communication, and we think that we have a very good handle on what the need is and what the capacity looks like. So it is really important that capacity isn't just about numbers, and it isn't just about availability. So capacity is about the individual's ability to access the support and service. And that really comes down to allowing our partner organizations and encouraging them to make their decisions based on a safety focus. So they have the ability to determine who can access their services, and they need to make those decisions with full autonomy in accordance with their own policies and procedures, and they need to make those decisions based on safety. So safety for clients, safety for staff. So I wanted to talk about some of the recent enhancements that have been made, and we are always looking for ways to enhance the services that are available in our community. And to this end, we have been working with the Chief Mary Bernard Memorial Women's Shelter to agree on a per diem rate to be able to support their ability to support non-Indigenous women and Indigenous women who are living off reserve, who are accessing temporary shelter. So this is a conversation that we've been having for a number of months, that arrangement will also allow us access to data that we haven't previously had access to, and that, of course, will allow us to make better decisions on our long-term planning and capacity needs. So we have also been working with the Lifehouse Women's Emergency and Transitional Housing that are affiliated with the Boys and Girls Club in Summerside to look at opening their service, hopefully early in 2022. We have increased funding to Blooming House Women's Shelter to assist with their expanded services, including longer hours and the provision of a resource coordinator. And we've recently added 4 scattered supportive housing units in Charlottetown, and we do believe this will alleviate some of the pressure on existing shelter facilities. And something that I didn't add to the slide, but certainly is important, is that we have partnered with Peers Alliance to offer a new position of a street outreach worker. And that position is really connecting with clients that are users of the Community Outreach Center and really making linkages back to be on the street and to be communicating with individuals and really focusing on harm reduction approaches. So when we think about plans to increase capacity, we know that there will be 2 emergency shelter beds coming online in Summerside through Lifehouse Shelter. We are currently exploring partnerships to offer men's shelter in the Summerside and Prince County area in 2022. And we are currently addressing the coordination of men's shelter services in Charlottetown. And this will address concerns that have been heard recently around the idea that men are having to choose between food and shelter by lining up at 4 or 4:30 in the afternoon to access a shelter bed. So what will be happening, we're currently working on the policy piece and the structure, how it will actually work, the logistics of that, but booking of beds will be made through the shelter support line, and individuals that are accessing services at the Community Outreach Center and through our partner organizations throughout the community will be able to assist clients to call to reserve their beds. So both services will be able to be booked through that shelter line, and that will alleviate the need for individuals to line up to access that service, and they will then be able to access, with more regular frequency, the soup kitchen and other supports that are in the community. So we see that as a really important move forward. We are also, we continue to use hotels to support our clients and our services. It is not the first option, and it is only used when it's appropriate. Not all the clients that call the shelter support line can or will be placed in a hotel. It is our intention as we go forward into the new year to dedicate a new resource to work with clients who have been accessing shelter beds for an extended period of time. And this time frame really ranges from 30 days up to 1 year. We want to really start to address the barriers that exist that are preventing these folks from securing independent or semi-independent housing. So we'll be turning our attention to that in the new year. And we want to continue to explore options that support the entire housing continuum. So we know that by the time somebody reaches this shelter stage, they've experienced lots of different events. And we want to be able to support those individuals and ensure that we've got a wide variety of supports and services throughout the housing continuum that meet all of the needs. We want to continue to collect information and better understand the needs of those in our community. So when it comes to the strategy for communicating additional shelter spaces, staff at shelters are aware when additional beds are in use. So when there's a weather event, when we're seeing higher than normal capacity, when there's a need to activate the 2 additional beds at Bedford McDonald, staff are aware, shelter support line staff are aware, community outreach center staff are aware, and I think it is important to note that daily staff at the community outreach center are communicating with clients to ensure that they have a plan for shelter, and they're always working to support those clients to access shelter, whatever that looks like. So whether it's using a formal shelter support or whether it's reaching out to friends and family, trying to help them to repair relationships or build relationships, whatever the case may be, but it's always about supporting and ensuring that everyone has a plan to be safe. The shelter support line is aware when we have made accommodations to book additional hotel rooms in the event of weather events, and we use public service announcements to communicate messages. So the current process for the shelter support line, this is a line that's available 24 hours a day, 7 days a week. And our experience in providing this service is that there are 3 main reasons that individuals call the shelter support line, and they are to do advanced planning. So someone's been served an eviction notice and they know that they're going to have an impending housing need. So they will call to gather information about what services are available in the community. In some cases, individuals call on behalf of family or friends. So someone may have a concern about an individual's housing situation or wanting to better understand how they can access supports that exist. Or individuals are calling on behalf of themselves or others that someone is in need of emergency or temporary shelter. So staff that are answering the line are using a prevention and diversion approach where they're attempting to support a client without seeing a client enter into shelter. So there's lots of opportunities to provide information, to make referrals to service providers, including the housing navigator, and also if at the end of the process it is determined that someone requires shelter, then they are making a warm transfer, calling on the client's behalf. So when we look at sort of the process when someone's calling in, the first step in that process is really to triage, so to gather information about the caller in an effort to determine what the caller's need is. So from here, staff can determine what information, resources, or referrals may be required to best support the client. When we think about prevention, these are really the activities that occur before an individual or family has legally lost their ability to reside at a residence or, while there's still an opportunity for them to continue to remain in that residence. So for example, if someone was in rental arrears and they were facing a possible eviction, they or a family member or friend could reach out to determine are there supports that are available to help this person to prevent that eviction from occurring. At this time, staff are really asking a lot of questions about the caller's situation and really attempting to determine if the caller can remain in that particular housing situation. And they are working with the caller to do whatever they can to keep that individual housed, and that may mean that they're making referrals, social assistance, or they're contacting a community organization on their behalf to try to access some additional supports. So we're really trying to prevent people from ever losing their existing housing situation and recognizing that there are cases where people simply don't know what the supports are in the community. And we've got a great network of community partners that are able to really move quickly and swiftly to help to support people, but we can only do that when we know. So we do encourage people to call and look for the support that they require. And when we think about shelter diversion, these are really the activities that occur once someone has identified that they've lost that whatever their housing situation is, but it's prior to entering a shelter. And we want to keep people from entering shelter as much as we can. So staff explore options with the caller to find an immediate, safe, and appropriate place to stay. And this can include like exploring conversations about possible friends or family or other supports that exist within the community. It can look like referrals to community supports that might include the housing navigator, social assistance, Canadian mental health. And if through that process it is determined that there isn't a way to prevent, there isn't a way to divert, that the person needs shelter, then what does that look like? So after sort of going through a series of questions, understanding what the person's need is, if there is a shelter need and there's a shelter bed that's available, that's what's offered to the individual. So that's in the case of a single individual, male or female. If there is a shelter need, that's what they're offered. If children are involved, there's always a hotel arrangement that's made. So when a caller can't stay in a shelter due to a lack of available beds, a special medical or disability need, family composition, or connection to the community, we've talked about this a number of different times. When someone's calling from Musqueam and they have a connection to the community, they have employment, they have children in the community, they have a connection with a community organization that requires them to stay in that community, we do everything we can to place them in a hotel in the Summerside area or wherever the closest community is. So we've been really working to enhance this service and trying to focus on really supporting the individual needs based on the specific circumstances of the caller. So that's the end of my presentation. I suspect there'll be some questions.
Carla?
Thank you, Chair. And I have a bunch of questions, but I'm going to start with a few just kind of from the presentation.
Sure.
You had mentioned that client participation is required, and I'm wondering what clients are saying to you about why they're not participating, because we certainly know that there are barriers that people face. So what are you hearing from them if they're not participating?
Well, in some cases, people don't want to go to a shelter. In some cases, they may have had experiences in the past that haven't been positive. In some cases, people don't want to be part of case management or follow-up requirements. Some people have a fairly clear picture of what it is that they want, and it's what we would all want, and it's housing. Right? And so in some cases, people are unwilling to access shelter supports. And in some cases, their past behaviors or practices have created a situation where they're unable to access those supports. I think in some cases, it's that they don't want to leave whatever their current situation is. And I'm thinking about times when staff at the Outreach Center have been in discussions with clients and trying to encourage them to leave a situation that they're in that isn't a great situation. It's not healthy, but they have, apprehension about leaving the situation they're in or entering into shelter supports. It's, there's cases of individuals who do not wish to recognize that they are experiencing homelessness.
Carla?
Thank you, Chair. And one of the things that I was very pleased to hear when I was at the Community Outreach Center was meeting the outreach position that was created with Peers Alliance. That's a great addition. And one of the things that you had mentioned through that is that the harm reduction model. And then, whenever we look at people who don't want to go to a shelter, who have, is known to the department and they may not be suitable for hotels. And then I hear stories of people who are living with great trauma, they have night tremors and can destroy a hotel room in their sleep. And so I'm wondering if there are people who don't want to go to a shelter, if there are clients who have been identified as not suitable for hotels. What do we do with them then?
Well, I think that we continue to work to support them in whatever way that we can, and we're constantly talking to our community partners about what that looks like. So we know that there are people who are unable to access supports, but, we're always talking about what does welcome back look like? How can we offer someone an opportunity to be supported, even though whatever has happened in the past has been, perhaps traumatic for the client, but also traumatic for staff. And so we're trying to work within our partners to see if a female identifying client can't access the support at Blooming House because of something that's happened in the past, well, would that client be willing and able to go to Chief Mary Bernard? And if that's the case, how can we make that happen? How do we support that transition? Do we transport that person? What does the follow-up and check-in look like? So it's all those conversations about, these are the services that we currently have available, and this person, for sometimes one, sometimes many reasons, is unable to access whatever that particular support is. Then how do we work with them to keep them safe? How do we continue to support them? We know from talking to other organizations, other jurisdictions, particularly and recently in the Atlantic provinces, about what are some of their outreach measures. What do they look like? And in some cases, in some communities, in St. John, New Brunswick, they're working with the local emergency measures organization to prepare and provide survival kits to individuals who can't access existing services, so that they can be as safe as they can. We know that our community partners in many cases have provided sleeping bags and gift cards and food supplies to try to help to meet people where they are to the best of their ability. And I think it's really important that, we have put a number of measures in place around the Community Outreach Center, around case conferencing tables, around collaborative efforts to keep conversations going amongst and between community and government to continuously revisit someone's situation and never, it's never a locked door. It's never a complete denial of service. It's always about how do we continue to support, what are the other options that we can explore, can we bring this case to bridge, and can we see if there's an intervention that can be made? Can we act on behalf of this client to explore, we've had a client recently that, is a client that's probably best suited for community care, but, was asked to leave community care. So how do we try to help that person get the right level of support? So acting on the client's behalf, supporting the client, assuring that we have their consent, attending appointments with them, speaking on their behalf, offering to, negotiate with a landlord that, yes, this person needs this housing support and this organization will continue to provide case management supports, and giving landlords assurance and that, sort of support that we're not going to just put this individual in this unit and walk away. We're going to continue to support them. We're going to assure that they continue to, make their regular appointments and attend to court and all of the things that need to be done to support the person in the place that they're in. It's not a perfect system.
Carla?
Thank you, Chair. And no, you're right. It's not a perfect system, that's for sure. So one of the things you talked about were survival kits, and I know that that's something that the Peers Alliance outreach worker does. She was telling me that she regularly visits the tents around Charlottetown, which there are still tents around. I see them. I saw one this morning. So I'm wondering, one of the things that came out of the findings of a community needs assessment on emergency shelters, which was created in 2019 for the PA Department of Social Development and Housing, and there were a couple of really strong recommendations in there, and the minister said in the House that they did look into, that you did look into mini homes and storage containers and those sorts of things for people who, like you say, for various reasons, shelters don't work for them. I heard from people who can't sleep sometimes in shelters. They're not people who are involved with any harmful substances, and they find it really hard to sleep. And so these options are really good on several levels. So I'm wondering, I'm getting away from my clarification questions because I'm getting down this hole, but I'm wondering what's been done and what can you give us an update on kind of like the mini homes or the storage containers, which we're seeing in many jurisdictions as something that's quite successful.
So those are innovative approaches that are being used in lots of different jurisdictions. They certainly require a level of municipal engagement. because there definitely are zoning concerns and there are community consultations that have to be undertaken. And, I'm not aware of any recent conversations that we've been having, but I know that, it is something that's been discussed in the past. I'm not certain that we feel right now that we have kind of that connection with the municipality, or that we've got enough perhaps buy-in from the municipality and ownership and recognition of how much responsibility rests with the municipality for addressing homelessness.
Yeah, I don't think there's much more to add to that. I think we have had conversations about it. We've had to look at it. Again, it's been kind of evolving over the last couple of years since we've been in play. We've seen an increase in the homelessness and into the shelter use and into some maybe high needs individuals and clients, and it'll be something that we'll continue to address. But to add to Shelley's point, it's not as easy as just putting containers down somewhere or building a container facility. They do have the facility on Fitzroy that CMHA is now currently building for clients, and it's a modular type build. It does get built quickly, which is good. I think they'll be done sometime probably by the late 2022. But again, it's not that easy again to do zoning, to where you can find land, what you can do. It might be even easier to be able to maybe find an empty building that we can renovate and make possible. You talk with the current clients, this seems to be something that's just kind of come about in the last, I'd say, year or so. We haven't seen this a couple years ago. Again, to go back to our earlier conversation on the shelter, and we opened the shelter up maybe just back in February 2 years ago, we didn't know if there'd even be a demand for that. We're obviously seeing a demand. So we're seeing that throughout the last couple of years, and it's something that we'll continue to address. But it does have some hurdles attached to it.
Chair, I'm just going to, one more comment and then I'll get back on the list for after. I find it a little shocking and disappointing that there hasn't been discussions with the municipal level, or I'm sure that you've attempted and you said there hasn't been buy-in, but this is the job of social development and housing and the municipalities to work together. And I mean, this needs assessment and the Eastern PEI housing analysis that was done, there's all kinds of data. And it's not just emergency shelters why we need it's not just for people who are experiencing homelessness that we need shelters, right? With increased weather events, we're going, look at BC, look at Nova Scotia. These are talks that we should be having with municipalities and communities. I know it's a little bit different, but this is, I assumed that there was a good, strong working relationship there. So
I would just, there has been conversations with the municipalities, on the outreach center here and on housing options in town. And this all started back when we bought Smith Lodge. So I think they are ongoing, but they're not as easy as just putting it in place and saying this is what we're going to do. We also have to make sure that when we move forward and do this, that is a demand for this type of situation. I mean, you need to make sure that when you're going to go build a building that's going to cost $8 or $10 or $12 million, that there is a capacity for that. So we're looking at different options. Can we find we have options in town right now where there is housing available or will be coming available that is zoned appropriately? And it all comes down to the strategy of what's the best utilization for those buildings.
Michelle?
Thanks, Chair. Thanks for being here today. I'm actually going to follow up on that last question that Carla asked. So when you say you're having conversations, can you tell me, are those in a formal setting? Like, have you actually presented to council, for instance, here in Charlottetown or in Summerside, to set out some sort of terms of reference of how you can find a working relationship that's formal?
I wouldn't say it's necessarily formal or informal. I mean, these conversations are ongoing all the time. Whether it's even the conversation we had around table in July at the outreach center. I mean, it was talked about there as well. What do we need to do? We're talking about Smith Lodge right now. What is the best utilization for Smith Lodge? As I said, we have other housing options in town that are going to become available that are zoned appropriately. And it becomes just a conversation amongst all the partners all the time. I mean, this isn't something that's just segregated to a certain day of the week or a month of the year. I mean, this is ongoing conversations every time we get together. So I don't know if it's formal or informal. It's at all times that we're talking about it when we're talking about the homeless population as a whole.
Michelle?
Thanks, Chair. So have you had a formal ask to the city of Charlottetown to rezone any piece of land that might be suitable to accommodate some of these housing options that were presented in that report in 2019?
I would have to look at the report and see exactly what the housing options are referring to. As I said, we do have housing options in town that are waiting to see what the best utilization is for them for. They're currently being used today. When they're not in use, we can reutilize them. Whether it's going to be, again, whether it's Smith Lodge or other options in town. We have to look at just for this population base, we also have the current population base, which is increasing. We have to look at whether there's a youth population base we have to address. So it's not just one segment of the population. I mean, we have to look at the whole overall population that we're dealing with.
Michelle?
Thanks, Chair. So my colleague specifically called out mobile homes, or that size of home, which I understand is not part of the zoning here in Charlottetown, and she also mentioned storage, like shipping containers. Have you had a conversation formally? So I'm just gonna, I mean, I've watched what the town of Stratford, who is a municipality and who has to go through rezoning, and what they've had to do in order to go through rezoning for their community campus, for instance. It's a long, very formal process in which you have to put submissions to IRAC, et cetera. So I'm asking, have you had clear, formal discussions with the city of Charlottetown or the city of Summerside on those two options that the report of 2019 suggested that the province look at?
Because right at the moment, I don't know if shipping containers or if mobile homes is the right option. There are other options in town that we are looking at right now. There's also, again, you can do a modular building. We've proven on Fitzroy Street that's in process right now that could be done in 18 months, or probably approximately 18 months. So just because it was mentioned, the thing that mobile homes or shipping containers, I would assume those are probably examples that could be used to accommodate people. But there's also other ways to accommodate people, and that's what I'm trying to address. It's about bed utilization in my part, and there are beds that can be utilized, and that's what we're looking at from our angle.
Michelle?
Thanks, Chair. So I'm going to go back to the beginning where we talked about how many beds were available and in what facility. Do you have data to identify how many people have been turned around on a daily basis or a weekly basis or a monthly basis? Because there hasn't been enough capacity in the shelters in order to accommodate their needs.
Are you saying turned away or turned around? Like,
Turned
as in
away.
denied service?
Yeah. Well, where they've been told that there's no capacity.
Yeah, we would have some data about that, Michelle. I don't have it with me here today. But what we have to remember is that each of these organizations operates their own service, and they do have reporting requirements to the province, and that's been evolving. So Blooming House is, a fairly new service, and the reporting requirements have changed with the most recent contract. So prior to that, we would have had the reporting would have looked a little bit differently. And as we continue to evolve our services, and I think it really is an important point to remember that like 3 years ago, the only budget item from housing services for this sort of support would be an annual grant to the Bedford McDonald House, right? And so since that time, like in the past 2.5 years, we've added supportive housing, we've added the Community Outreach Center, Blooming House is a new shelter. We've got several different community-based partnerships going on with people. So this in some ways doesn't seem like we ever have enough supports, but we're really only just starting to understand what the needs are, because the needs are growing and they're changing and it's evolving, and we're working to collect better information, better data, so that we understand what the needs are and where we need to go in the future. So the short answer is we would have some available information about nightly turnaways, or we have monthly reporting on bed nights that we would receive, so we would understand like what the percentage of capacity over the month is. But we don't look at, we wouldn't receive like on a daily basis. I wouldn't be able to tell you how many people slept at Blooming House last night, But I am happy to say that going forward with the implementation of coordinated access and HIFIS, we're going to have an awful lot better information to work with, where all of our shelter partners and community partners that are providing housing and housing supports will be using this centralized data reporting system. So we'll have a much better understanding of what that nightly capacity looks like, and we'll be able to move more quickly. But I think it is really important to note that, like, opening a shelter and gearing up to open a shelter and all of the policy and the process and the zoning and the funding and the logistical concerns and what the building needs to look like and what it, you know, how do you train staff and how do you gear up is not something you can snap your fingers and make happen. It's a long process. And if we think about, you know, the experience of Lifehouse in Summerside, we've been talking with them for 18 months, I think, that we've been meeting with them on a very regular basis, and they are aligned with one of the strongest community-based organizations in Prince Edward Island, the Boys and Girls Club. So they've got all the tools and all the gear they need to operationalize, and it's still been a very lengthy process for them, and they've had tremendous support from government, from community, from, you know, other levels of government in terms of operationalizing, and they're still not open. So it's a process, and it's about understanding what the needs are and what the service will look like and how do you prepare yourself for that. I know that was a very long answer, but it's just that the whole thing is evolving all the time. So we do have some, we would have some of that information.
Michelle?
Thanks, Chair. So I think, Shelley, the first time you and I met was actually at Blooming House when
Yes.
they had an open house. And what sticks with me from that discussion and how open Blooming House was the data that they provided to prove to everybody that there are homeless women in Charlottetown or in PEI, because for the longest time it wasn't seen as a great need. And so that's something that we often find our NGOs having to do, is to prove themselves whenever they're providing a service on behalf of government that they say is crucially important. And they have to provide the data in order to show that. So I know Blooming House actually captures that information very rigorously and very impressively. I'm going to say the way that Blooming House tracks the supports and where people need, whether they need transitional, whether they need mental health supports, addictions, all of that. Yep. They capture that to provide it so that we know what services and programming we need to be able to provide in order to take people and clients to their next step, right? Of whether that's recovery, whether that is housing, whether that is whatever. So I know for a fact that Blooming House captures that information and are very proud of the information that they capture. So other facilities that are offering shelter beds, are they required to give that same kind of data and in order to keep their funding?
Yeah, so that's what, like, your question wasn't specific to Blooming House. It was about whether we have the information. And what my response is that we do have some of the information. So it is evolving in terms of contract reporting. But you will note that in the presentation, I noted that right now we have contracts and contract reporting requirements for both Blooming House and Bedford McDonald House, because those are the two community partners that we have a reporting requirement with, that we hold a contract with. I talked about the fact that we are currently negotiating an agreement with the Chief Mary Bernard Women's Shelter, and once that agreement is in place, we will have monthly reporting, and that will be something that we'll be able to better report on. Deacon House was previously operated by Health PEI. We don't control the information that they collect, but when we know that we've assumed the service, we know what we're going to collect, we know what we're going to look at, and we know what we'll be able to report on. And daily capacity, turnaways, the reasons for people being turned away, all of that is very important information, and we will be tracking it, and we will be able to report on it. Anderson House has a contract with the province, but it doesn't fall under our responsibility, so I can't comment on what's contained in those reports.
Michelle?
Okay. Thank you. And I think the other conversation that we had at the time, and I know the Outreach Center is not what we're discussing here today, but the other component that we had discussed was the fact that having the Outreach Center allowed you to collect a lot of data. And so you showed us figures when you were here the last time that had to do with homelessness, mental health supports, addiction supports. And one thing that I pointed out is we are severely lacking in the mental health and addiction supports required in order to help I believe it was 91 clients in the month of July, I think was the number, or maybe it was August, And we have 4 hours a week dedicated to counseling services. So obviously that's not enough. So even when you do have the data, we're still not we're still not at the place where we are supporting the clients as they need to be supported where they are at that time. So once you start, and I have to say, I'm actually surprised that we don't have the data from the shelters that you are collecting the data on, because I think I ask for data every single standing committee that we attend, and it would just be something that would back up statements that are being said here in this chamber, as well as allowing us to ask other informed questions or removing questions that are based on whether you collect data or not, which is something that we should be doing anyway. And I know that we require our NGOs to do it at a very, very rigorous pace. So my question is once, with that data that you have for Bedford McDonald House and for Blooming House, who is reviewing it currently? Because that data has been provided for the last 2 years. So who's currently reviewing that historical information that's been provided to you? Because we don't have to wait for all of the shelters to provide data. If you have any kind of data to start, you should be using that on a very regular basis to support any of the continuous conversations that you've been having to actually create action instead of conversations. So who's reviewing that data on a regular basis, and what has it been used to so far in order to support any decisions that the department has made?
So the reporting comes to myself, and it is shared with other members of the Housing Services Division for review and consideration. And I would point to a couple of examples, like support for Lifehouse Women's Shelter and Transitional Housing in Summerside as being, a direction that we felt was a very good direction for us to go in. Based on information that's provided, but based on also feedback that we received from the community. The recent, movement toward initiating conversations and pursuing options for looking at men's shelter in the Summerside and Prince County area would be a couple of examples. I think all of the partnerships that we are either currently engaged in or have created over the past couple of years have been born from feedback we've received from the community. So when we hear from Peers Alliance that they feel that there's a need for a street outreach position, we agree. We agree based on what we see, what we hear, and the data that comes forward to us through regular reporting, like from Bedford McDonald and like from Blooming House and the Community Outreach Center.
One more.
Yeah, Michelle.
Yeah, and then I'll move away from data. So does the data support having only 10 of the 12 beds at Bedford McDonald House open on a regular basis?
Currently, I would say it does, yeah. I mean, we have year-over-year data that we're looking at and considering and seeing how does August of this year look versus August of last year, and what did it look like the year before? What does October look like? When do we think that we're nearing capacity? What do we do? How do we, and I think one of the responses that I'd point to is that we know that we have men who have been staying for extended periods of time at both Bedford McDonald House and Deacon House. And there have been attempts made and offers made to try to assist those folks to identify if they're interested in supportive housing options, and in some cases those individuals have flat out declined that offer to participate or to be assessed for suitability. So one of the new measures that we intend to take is that when we've taken on the service of delivering Deacon House Men's Shelter, is that we'll have a support person who will be available to really start to focus on addressing what are the barriers that are preventing those individuals who've been staying for a long period of time in both Bedford and Deacon House, and how do we move forward with supporting those individuals. So I think there are a number of examples where we're looking at the data and asking ourselves, what is this data telling us? And why are we seeing increases in certain times of the year? And, is there something different that's happening in the community right now?
Sydney?
Thank you, Chair. Thank you both for coming in. I appreciate the time and effort into the preparing for coming in as well. Just a quick comment on something you had said earlier, Shelley, when you said, what does welcome back look like? It was quite reassuring to hear, that it's not, regardless of how the situation of a client, that there's always a, what does welcome back look like, and trying to make that work. My question is around the shelter support line, and when you say it's open 24 hours a week, 24 hours a day, 7 days a week, what does the schedule look like of who's on the other end of that line, depending on what part of the week it's at?
Yeah, so there is a dedicated prevention and diversion coordinator position attached to that line through the Salvation Army as the deliverer of the service. And they have a dedicated support who answers that phone Monday through Friday from 12 p.m. to 8 p.m. So that person has really been focusing on those, prevention and diversion approaches and, enhanced training opportunities, looking at how to follow up to support clients after the initial call is made. In between those periods, so like from 8 p.m. then to 12 noon, the phone is answered by staff at this supportive housing option, the men's supportive housing option. So staff that are regular employees. They've also been trained in prevention and diversion. They are familiar with the process. They've been prepared with a standard set of diversion type questions to help to support the calls.
Sydney?
Thank you, Chair. In the slide it says those that can call on behalf of friends or family. I know I had called on behalf of a constituent this year who didn't feel comfortable calling or understand the process or what it looked like and stuff. And at that time, the person at the end of the phone had told me that I couldn't call on behalf of someone. Has that policy changed, or is it okay now, or was there just a misunderstanding there?
There's always been folks that have called on behalf of others. So, if someone is being discharged from Mount Herbert for mental health and addictions, there's always been the ability for someone to call on someone's behalf. I'm not sure about the particulars of the circumstance, but what has become or had been an issue in some particular cases in the past is when someone is calling on someone's behalf and demanding that they be placed in a hotel. And it is our policy that we need to talk to the actual person who is in need of shelter before any shelter arrangements would be made. So someone can call and collect information on someone's behalf. They can find out what services and supports are available, but the staff answering the phone need to talk to the person who's actually in need of shelter. And you can kind of imagine why that might be, right? So if we think back to our initial delving into the temporary shelter support line and hotel placements, we had, and this would be in like 2018, the winter of 2018, we had a number of individuals calling on behalf of other individuals securing hotel rooms, and things didn't go well. So everything happens for a reason, and there's a reason that policies and procedures evolve. And so it's absolutely not a problem for someone to call on someone's behalf to collect information. But if it gets to the stage where there's a shelter placement or hotel arrangement that needs to be made, the staff are required to speak to the individual that's in need. And that's to assure that the person is legitimate and that the situation is legitimate.
Sydney?
Thank you, Chair. Yeah, and I can appreciate that. In the case that I was dealing with, that's what I was looking for, was for them to contact the person in question, or the potential client, and figure out what services were available, regardless if it was shelter or hotel bed, whatever it might be that was set up for that person. At that time, though, it was made clear that and maybe it was just a misunderstanding with the worker, but it was very much you're not supposed to call on behalf of somebody, but we'll do it. And I was like, well, I don't want to be like that kind of thing. I just want to make sure that this person is contacted, and it all worked out in the end. Which I guess leads to my next question, and this could be a one-off, but in that example, they were going in on a Friday, and I'm curious to know what it looks like the advanced planning or the planning for after that. So when the client is obviously can be in a chaotic situation or a stress situation. Could be very much a trauma situation too, depending on the reasons that they're going there. But that follow-up in this case in particular didn't happen, where it was checkout time, so to speak, and what do I do now? And then they're calling back to the person that helped them in the first place. What's the planning for following up with the client to know what the next stage looks like? Or we're going to book you for a couple of days, whether it's a hotel or the shelter, that kind of thing. What about that follow-up the next morning, or whenever it was in 2 or 3 days? How does that look like?
Yeah, so it really should be that the prevention and diversion coordinator is contacting the client to then discuss what are the next options. So let's imagine that the call takes place for the initial placement at, say, 10 o'clock at night, and so it's a regular staff person who's working at the supported housing option. So in the morning or at noon the next day, when the prevention and diversion coordinator then is back on the phone, they're intended to contact the client to find out, what are the specific supports and services that they need to be connected with? What is the longer term plan? How do we help you to find appropriate, suitable housing? And how can we connect you to others? So that is their role and responsibility. They also make referrals to other organizations, other agencies, and other individuals. So it could be that the person, does have a complex housing need, and they will be, and they are appropriate for referral to the housing navigator. So that prevention and diversion coordinator contacts the client. They discuss their particular situation, collect any additional information that they need, and they may reach out to the housing navigator to have that person make connection with the client. So there is a process that's laid out, and we are constantly having conversations with the Salvation Army about improving that service and how that can be enhanced and what are the tools that they need to enhance that service. I'd say that's an ongoing conversation.
Sydney?
Thank you, Chair. So in the prevention diversion coordinator, that's based out of the Salvation Army right now. So would you consider that almost like the file worker, the case worker that's controlling each of the files or clients that happen to be receiving temporary shelter? Are they helping navigate each of those files at any given time?
That's the role.
Okay.
Yeah.
And you say it's evolving all the time when that person has too many files, or I'm trying to think of the gaps, like if they're not there, or if it's a different person a different day, like are we getting more comfortable that this, that what's the feedback for as far as following up that next day kind of thing?
I think we can always do better, right? We can always work to improve our services. And so it should be, if you kind of imagine the work week, when Friday comes and that individual, isn't going to be in on Saturday and Sunday, any placements that would get made on a Friday evening are very much need to get whoever the individual is through to Monday when regular staff are back at their desks, right? So I think that there are, plans about how it's supposed to work and what processes are supposed to be followed. So if a decision is made to put somebody in a temporary housing situation, in a hotel arrangement on a Friday night, it's supposed to be a 3-night booking, because there shouldn't be anybody wondering the next morning when they wake up, do I have to leave this hotel today? We don't want that. People are in complicated situations enough. That should not be what their worry is.
Sydney?
That's good to hear. And then also, like, knowing whether it's the housing support worker or the prevention diversion coordinator on Monday morning, right? Like,
Yeah.
I have no doubt that person has a number of files on their plate first thing Monday morning. So, being able to, I'll say predict the future, but maybe it needs to go to Tuesday, or at least till Tuesday, Monday afternoon or something like that, depending on the situation. I'm good, thank you, Chief.
I'll just ask a few, and then we'll go back to Carlos, I think, next on the line. I think it was mentioned that Bedford McDonald House opened at 4. I do believe it's 4:30 is the open time there.
I think you're right.
And saying that, I have a problem with the dignity associated with having people line up for beds. It happens at Bedford McDonald House, and it happens for the next 4 hours at Deacon House. Can you talk to ways that we can look at this situation where people aren't lining up for a bed during that period of time?
So our plan is to coordinate the access to beds for both Bedford McDonald and Deacon House so that there is no more lining up, so that a reservation for those beds can be made, and they simply need to show up when the doors open.
Yeah.
So their name is on the list, and they've been assured that they will have a bed. And that is the process that Blooming House uses as
Yes.
well. And I think that the difference is because of the location of Blooming House, we don't see people lining up and their transportation's arranged, where Bedford and Deacon House are both within walking distance
Yeah.
of the downtown.
Yeah. Well, I was just down there 2 days ago and talking to the people in line,
Yep.
and it was cold,
Yeah.
and their stories were, their stories are difficult to hear, and my heart went out for them when there's people inside and they're outside waiting for a bed. So I think there's a major process issue there with that. Saying that, the 2 beds on the ground floor that we're talking about, when was the last time they were used? Are they being used consistently? I know there was huge timeframes where those beds weren't being used. I'm talking about the beds. Can you tell me if those beds are, like, you call it overflow, it's been called emergency, those 2 beds are emergency beds. What are we doing with those? Why are people not in those beds?
So one of them was used last night. They're used on an as-needed basis. They're used in cases of extreme weather. They're used when when Bedford is full and Deacon is full. They are used. They're used when they need to be used, but the shelter itself is equipped to have 10 regular beds. It has 1 washroom. So you kind of think about some of the logistics of that many men in a house, right? All needing to be supported, right?
Yeah.
And
No,
they're temporary beds that are set up, in
Yeah.
the dining room area. I'm sure you've been inside
Yeah.
of Bedford, right? So,
And
yeah.
they were also supposed to be accessibility areas, accessibility
right.
beds. So I have concerns around that. And I mean, if there's issues with the amount of bathrooms and stuff, maybe that could be a question that I'd be asking. Like, can we look at, if there's a huge demand, can we look at issues or different ways that we can make that house more efficient? Saying that too, in the recommendations on that report, and it's a great report, the Findings of Community Needs Assessment on Emergency Shelters. Recommendation 1, increase housing supply for emergency shelter, transition housing, supportive housing, and subsidized housing. Underneath it says, for both men and women, it says identify a long-term solution for a women's shelter, men's shelter with 24-hour coverage, providing dedicated case management and wraparound services. I guess that was done before when Bedford was operating 24 hours a day. Now it's only operating 16 hours a day. In the recommendation from that report, they're saying 24-hour coverage is important. They're saying case management is important, and they're saying wraparound service. We've talked about a little bit of wraparound services. I'm concerned about if there's any indication that Bedford McDonald go back to a 24-hour operation, which would provide coverage during the day, and what's the case management situation around each and every client?
Okay, there's a whole bunch of stuff there, but
I don't
so
want to give it back to you.
most shelters don't operate on a 24-hour day cycle, and Bedford McDonald House operated on a 24-hour day cycle specifically during COVID. And it was a response about keeping those individuals out of other supports and services that were very limited in the community at that time, and it was a very specific response. We have been focusing our conversations and our recent additions around supportive housing so that we can have that 24-hour-a-day support, and we can have that dedicated case management support, and we can have those dedicated wraparound supports available to our clients. with the intention that we're helping people to move along the continuum. So again, back to the, the purpose of emergency sheltering is it really should be looked at as a temporary support, right? For a short duration in time, and it should be approached with a housing-focused approach where we're always encouraging people to look at exploring ways to be more sustainably, suitably housed, right, in their own housing. So whether that's in, supported housing in a single site, or whether it's scattered supportive housing throughout the community, where we're working to secure units and then providing those wraparound case management supports for individuals who have indicated a housing readiness.
Saying that, I think we have some huge gaps right now. We have some huge gaps in what this report is saying where we are. And we talked about COVID. We're dealing with COVID. It's making things worse. I could go on. So
Can you just explain, sorry, Chair, just what you mean by huge gaps, where the huge gaps are, sorry?
well, the people that I'm talking to on the streets are so far away right now from getting any kind of case management support, any kind of dignity, any kind of optimistic plan, and any kind of housing supports. The person I talked to 2 days ago just was getting evicted that day. I mean, we're in a situation where we're scrambling. We're hurting. These clients are hurting.
So who's getting evicted from where, sorry?
He's getting evicted from his apartment.
So that's what the emergency shelter's for. And I
But
think
we're-
that's what the emergency shelter's doing. And then we also have the outreach center with working groups there to help these clients. So I don't know if there's huge gaps.
There's massive gaps because 2 of those clients just got suspended from the outreach center. What do they do now? That's the people that we're talking to. There's issues around what's happening. The demand is massive right now, and I'm just trying to figure out how we be supportive here and how we do that. There's issues around Smith Lodge. There's issues around Deacon House.
Sorry, the issues around Smith Lodge, sorry.
The issues around Smith Lodge. Well, I don't want to take up too much of the time with an argument right now. Maybe I'll have some time at the end to come back to those. But I think my point is, and the case management issue is that's a massive one.
So on case management, every individual who is interested in pursuing supportive housing, whether that be in a single site or in a scattered site throughout the community, is required to engage in case management. There are a number of agencies across the community that we work with that are, involved in delivering service at the outreach center who have dedicated case managers. So we know that there are clients who are supported by a number of different agencies, and what we have been trying to do is sort of streamline and coordinate so that someone, this person's not receiving support from 7 organizations and this person's receiving support from 1 or none, right, to try to use those tools like the case conferencing table to bring forward clients that are in need of support, that are in need of housing, that are in need of financial assistance, and how do we put together a case management plan that engages the client in their own journey, right, to access the supports and services that they need to move forward with whatever it is that, they're ready for, that they're interested in pursuing. So I think that there are a lot of case management supports that are out there in the community. And, all of the organizations that we've talked about in the past that are offering service out of the Community Outreach Center, like the Native Council, like Peers Alliance, like the John Howard Society. We've got the Blooming House Resource Coordinator who's at the Outreach Center every week on a very regular basis. So we have lots of case management supports that are available. But we also have a lot of very complex clients who have a lot of varying needs and levels of support required to help them to achieve what it is that they're interested in achieving.
Thank you for that. Carla?
Thank you, Chair. And I'm going to come back to something that was said a few different times, but when someone refuses services again and again and again, if we truly did operate with harm reduction philosophies, if we truly understood trauma-informed, and if we truly used a housing focus, we would understand that we need to go back again and again and again. And just because these services are available, if we understood the clientele with their complex needs, we would understand that just because they're there doesn't mean that people are going to necessarily access them. And it's important that they are there because over time, that trust may be built for them to reach out. But I think as a province, we struggle to understand this, and it's evident in our transitional housing, which I'm going to get to in a little while. And, you know, if our community partners are not able to help clients, it's literally government's responsibility to do so. And Deputy Minister, this question is for you. In this House during question period, the minister stood and said, and I could find it unanswered, that every single shelter is 24/7, they offer day programming, and that they have wraparound services. This is not true, right?
Well, I think, go back, Shelley, the shelters are not 24-hour services.
Chief Mary Bernard and Anderson House offer 24-hour supports.
Yeah. So,
All of the other shelters are overnight emergency out of cold models.
which all we have to do is read the report that was done for your department to understand where the gaps are. So it's really discouraging to me when I hear you asking for clarification on gaps.
Major gaps. Where are the major gaps?
Read this report, Deputy Minister. Okay, well, there are gaps, and if we were genuinely reaching out to clients and genuinely wanted to understand how we could help, we would understand those major gaps. So I guess my next question is on transitional housing. So we've been visiting seniors' independent living apartments. One such visit, actually, I believe 2 such visits the minister actually attended. And what we're hearing loud and clear from the seniors who live in those apartments, what we're hearing loud and clear from the media, where the seniors are reaching out, is that we have got people with complex needs who require supportive housing thrown into these independent living apartments, and it is not working. The people around them do not feel safe. The people around them are concerned about not only their own safety, but the safety of others. I mean, we've heard of fires being set in seniors' apartments. And one of the things the minister, I was very pleased to hear the minister say in one of these meetings, is that we have a huge gap in transitional housing. So a quick story, I had a constituent reach out to me about a man who, one such man who requires supportive housing. Coincidentally, I pop into the community outreach center as often as I can. Coincidentally, I met this very man one day, and he came right up to me and told me that he can't access his medications because he needs to pay half and he can't. So we can't say that we're putting people we understand have complex needs into seniors' independent living and providing these supportive services when they're not even on their medications to help them succeed even a little bit. So I would like an update on where we are. We identified transitional housing a while ago. I'm wondering if you could provide us with an update on where we are with transitional housing.
I might be confused about the question, and I would wish to not be confused about the question. So, are you asking what our current transitional housing opportunities are? Like, what do we have available and what do we plan to have in the future?
Sure, yeah.
Okay.
Yeah.
Okay, so currently, we have 10 supportive housing beds available at Smith Lodge. So that's, 24 hours a day supervised living. We have 6 units in a scattered site model, so not staffed, not supervised, but every client requires a case management plan, wraparound supports. There is a plan, and then we've recently added 4 additional scattered single sites throughout the community with the same intention, the same service. So the client needs to be ready to participate in case management, and they will have a regular visitation schedule by their caseworker, follow-up appointments. There'll be individualized approaches to supporting that individual. As we move forward, we're continuing to look for other opportunities to provide additional transitional and supportive housing options, because we do feel that that is a need and that's something that our clients could benefit from. So if we think about the gentleman that I've referenced, staying for long periods of time at both Bedford and Deacon House, are those clients, suitable candidates for supportive housing? How can we move them along? Does that answer your question?
Carla?
Thank you, Chair. Well, I'm wondering, we've identified it as a gap. Do we recognize, does government recognize that the current transitional housing, the gap there, I mean, 16 beds for transitional housing is not near enough as we consider how many different seniors independent living facilities who have people in there who have either personally said that they need more supports, or the people around them have identified that they are definitely people living in more support. So I guess let me start with this. Does government recognize that the gaps in transitional housing and the way we're dealing with people with complex needs by putting them in seniors' homes is leaving seniors fearful in their homes and fearful to the point where they don't want to leave their homes? Does government recognize that?
So I'm going to say first, there's not 16 supportive housing units. There's 10, and then there's 6, and there's 4. So that's 20. And in a very small population, it does make a difference. And no, but it does. And we've recently added 4 units, and 2 of those units we worked very closely with Blooming House to identify 2 female clients who were ready to move on, and it makes a huge difference. It makes a huge difference in their individual lives, and it makes a huge difference for Blooming House as an operation. So it is important. And 4 may not be a horribly impressive number, but we don't need 40. So we've been adding to our inventory, and we've been evolving our services as the demand has presented itself and as our community partners have indicated to us where the needs are. And I think that the issue that you're raising with the seniors is very specific to individuals who we can't come here and talk about. And I don't know that there's a widespread issue with seniors I don't know that.
I do.
Okay. So maybe that's something that we need to have continued conversations about. I'm not involved in them.
Well, just to go back to the meetings of a week ago and maybe 2 weeks ago, and it was addressed in our office, and we're probably looking at different screening possibilities before some tenants maybe go into the seniors units, that maybe allow them to go to other places. So yes, it has been brought to our attention. You say, is government aware? Yes, we are aware. And are we addressing it? Yes, we're looking at it.
Carla?
Thank you, Chair. I'm happy to hear that, and I mean, improved screening is great. I guess my concern is if we deem them not appropriate for independent living in a senior's apartment, where do we put them? Because we don't have anywhere right now. So what is government's plan to help people with complex needs?
Well, I think, and that's part of what we're working towards, is it transitional housing, as Shelley has talked about, because we can add more housing units as we go along. We have one right now in the process of being fixed up that will accommodate 4 to 6 additional as well. And I guess every individual would need to be looked at individually and what needs they need and how we can accommodate it.
I'm going to stop there because I know other people. I would like to say one more thing, and then I do have more questions, but I know I'm not the only one in the room. I guess where my concern is that we've got reports that were written, clear recommendations that we have not implemented yet, that we have not even really, I mean, based on conversation today, that aren't really identified as priorities. And it doesn't seem to be getting any better. So I hear these things, I hear what you're trying to do, and I hear what you're trying to, but a lot of the data we need to have communications with our community partners all across the island because they know it. They live it every single day. And, you know, I find it hard to sit here and listen to plans when we've not, like the last 2 years, it feels, and you know, I don't mean to downgrade the work that has been done, but it's very frustrating when you walk into the community outreach center, and it did not take me long to build trust with many of the clients in there. And when I walk in there and, you know, and I'm gonna give a shout out to them because they're trying to organize something. They're trying to, you know, when we've got a group of people who are so vulnerable, who have so many things that we take there are so many things in our lives which we take for granted, which they don't have. And, you know, and there's so many reasons for that. This homelessness is extremely complex. We know that. You know, when we look at mental health, we look at addictions, we look at childhood trauma, we look at poverty. There's just so many things. And we know that a basic income guarantee would help us identify those who are unhealthy or who are unhoused because of poverty. And then we would be able to create those wraparound services and it wouldn't be so overwhelming. Anyway, I'm going to leave it there for now.
Can I just interject for a second? You say there's nothing been done in the last 2 years. We've added the outreach center, we've added Smith Lodge, and now we're supporting Lifehouse down in Summerside. To say nothing's been done is completely wrong. We have addressed those issues. They take time to do these things, and we're continuing to move forward with them.
And I did follow that up by saying, I know there has been things done, but it's very discouraging when those things are there, there's been more services created, but people are still experiencing the same issues that they were experiencing years ago. Anyway, I'll leave it. Thank you.
Just to let the committee know, our guest, we have to stop at 11 a.m. So just for our guest purposes, so just keeping that in mind. So we'll just, yeah, Michelle.
Great, thanks, Chair. So we spent a lot of time on this report, Findings of Community Needs Assessment for emergency services from 2019. So that's over 2 years ago that the Department of Social Development and Housing received this. There's 3 recommendations in this report. So, Mr. Keywell, I'd like to know if you have an action plan. First of all, do you agree with these 3 recommendations that were listed in this report?
Can you read them to me, please? I don't have the report in front of me.
Yep, so recommendation 1, the chair already read that one out, was to increase housing supply for emergency shelters, transitional housing, supportive housing, and subsidized housing. Number 2 is adopt a client-centered, collaborative approach. Number 3 is develop standard data collection approaches and common reporting. Do you agree with all 3 of those recommendations from this report? So this report was delivered to the Social Development and Housing Department two and a half years ago, 2019. Do you have an action plan that outlines exactly how you're going to deliver on those 3 recommendations?
Can I answer the question?
Yeah, please.
Yeah, sure. Shelley?
Yeah. So we do have, and did publicly report an update on the implementation of actions recommended in the Community Needs Assessment on Emergency Shelter. So online, available in June, I believe, of 2020 is an update. And we are currently working on updating that further to kind of dig in to see which of those recommendations either have had additional actions taken or require additional follow-up. So when we look at the recommendations, many of the recommendations have been implemented, either wholly or in part. And specifically around the adopt a client-centered collaborative approach, there are a number of recommendations that have been moved forward with completely. So if you look around, training for frontline service providers, we've done quite a lot of work to address that.
Okay.
Michelle?
Thanks, Chair. So the Poverty Elimination Strategy Act sets out very specific targets to eliminate chronic homelessness by 2025. How are you moving forward to achieving that target? And how are you reporting on that so that you know if you're achieving the outcomes set out in that legislation?
I don't have those actions in front of me, and I think that there are a number of measures that are being taken, both in conjunction with the Community Needs Assessment on Emergency Shelter recommendations, along with poverty elimination, along with current undertakings in the community that are working toward achieving. And I think that some of our data reporting, some of our standardized reporting, contractual reporting, as well as HIFIS, will start to lead us toward having a better sense of what those outcomes look like and whether we are meeting those objectives or not.
Michelle?
Thanks, Chair. So the legislation is actually very specific. So, and it passed in May of this year. So that's you've had about 6 months to develop an action plan of how you're going to deliver on that legislation. Is that action plan completed, and can you provide it to this committee so that we have access to it?
We could probably provide where we're at to date, yes. I can get that to you, be done through, we're actually running that through the Poverty Elimination Manager in the house, in our department, so I could have her provide an action plan where we're at.
Thanks, Chair.
Shelley.
Thank you for that. And Chair, so what I'm struggling with right now is how to even hold the Department of Social Development and Housing accountable. Because unless we have very explicit steps on how we're going to achieve outcomes, it makes it very difficult for us here in the Legislative Assembly to ensure that we're going to meet the requirements of that legislation, that we're going to see recommendations in reports fully implemented, especially when we all agree that these are recommendations that should be implemented. And so I think that's where one of the most challenging things is. We talk about a lot of conversations, we talk about, things that are planned or considered, etc. But the actual work that has been completed in order to cross off action plan items is missing. And it is the responsibility of members of this Legislative Assembly to hold government accountable to ensure that we're meeting legislative requirements, especially with this committee. It's absolutely one of our mandates. So I appreciate all of the things that we've talked about today, but I really need to see a formalized action plan that's going to show us how you're going to achieve all of the outcomes here that we've agreed in this report from 2019 as being recommendations that should be implemented, and having that reported upon on a regular basis so that we can see that progress. That helps you, that helps us, that helps the public to understand all the good work that's being done and what's left to be done. So having formalized plans so that people can be held accountable is extremely important. And the other thing that I've noticed in this, and Shelley, this is nothing to your detriment. Obviously, you're very, very involved in the working group and the day-to-day and all of that. But again, where is the accountability and oversight role? Who's performing that? Because when you're so in the weeds and so involved, it's really hard to be an objective person to provide oversight to all of the things that are happening. So I would also ask that, is there an oversight process that is happening to ensure that whoever is keeping track of that action plan has the ability to do that objectively? Because you are absolutely involved in feet on the ground, and that is admirable, and that is what everybody that's involved in this issue, which is a wicked problem, and we need to have boots on the ground, but we also need the people to ensure that action plans are completed and action items are completed and obstacles are removed when they need to be removed, so that outcomes that are clearly listed and agreed upon that the department is going to act, that they're going to action, is being completed. And I know that that's so hard to do when you're working in it every day. We talk about this in business. You want to work on your business, not in your business, and that takes a real concerted effort to do. So my concern through this is, where is the accountability and those actionable items for the department to be held accountable to ensure that we are moving towards the goals that we've all agreed upon?
So
Shelley.
can I respond? So I think in fairness to me and to our deputy, we weren't asked to come here today to report on the community needs assessment. So if you were looking for an update on the community needs assessment, that's probably what you should have asked for, and we would have provided it. So we're happy to provide follow-up when it is available and when it is ready. It will be made publicly available as it was the last time, and it's posted on the government's website. We can make a copy available to you when it's ready. As far as the Poverty Elimination Act, also weren't asked to come here to speak to that today. And I think you can probably appreciate that it takes a considerable amount of time and effort to prepare a presentation and supporting materials to come here. And I am certainly not a mind reader, nor am I a forecaster of the future. So, if I'm expected to come here to speak about a particular topic, then by all means include it in the request and it will be delivered. Otherwise, we're happy to follow up on any requests that are made.
Michelle?
So I will read recommendation number 1 again. So increase housing supply for emergency shelters, transitional housing, supportive housing, and subsidized housing. That is exactly what we asked you to come speak on today. So it would be really great if the action plan was actually provided to us so that we could see that and then be able to follow the progress through. So I understand, no, we may not have asked you to talk on the really big topics, but both of those items absolutely have housing as one of the cornerstones of being successful, because we'll never get ourselves out of poverty if people are still homeless. It is one of the most critical components of being able to offer, to be able to actually achieve what was passed in this House through that legislation. So if we haven't identified housing as a major way to get people out of poverty, which is what that legislation was about, that's a huge concern for me. So I do apologize if you feel that we've gone out of scope, but housing and emergency shelters is pivotal in ensuring that we look after. Well, I mean, this needs assessments on emergency shelters, so it's absolutely within the scope of the project, of the presentation that we asked for today. I don't have any further questions.
We are kind of, did you want to, is okay? Yeah, we're just running out of time here. Yeah. So I just found out that there's 2 bathrooms at Bedford McDonald House, so, I mean, I don't know, so that's,
On the main, there's
Yeah.
1 washroom on the main floor and
Yeah.
1 washroom on the second floor.
yeah, okay.
And the washroom on the main floor is accessible.
Yeah, okay, perfect. Just wanted to clarify that. But I think this is an important topic, and I know it got a little bit tense in here. I think we're all trying to do our best for the clients out there and for the people that you serve and that we're trying to help out too as well. So I want to thank you for coming in. I know it's tough, but it's a good conversation. I do believe you might have some things to bring back to the committee potentially. Was that a formal ask or anything like just? Yeah. Yeah. Okay.
To this committee.
Yeah, perfect. So is that okay? All in favor? Say aye. Okay, so we'll go ahead with that. So thank you very much for coming in today, and we will give it a short break, and we'll continue. We'll finish up with the meeting. Okay, we're just back to conclude. So we're number 4. We'll talk about discussion of scheduling. We received a response from the Minister of Justice and Public Safety that he's unable to attend the meeting due to potential on Friday. However, the Director of Prosecution, Director of Legal Aid, and Management of Victim Services are able to attend. Is the committee wanting to go ahead with booking this meeting with those presenters? This is regarding the series that we've been working on to this point, so.
I was okay either way, so I would leave it up to members that really wanted the ministry here to.
Sure.
I was fine with either way.
Okay,
Those
great.
are the experts that I want to hear from. But if the people that really want the ministry to be here want to delay it to the new year,
Yeah. Okay. Perfect. Any input? Michelle?
Did you say who can attend again?
Yeah, it's the Director of Prosecution, the Director of Legal Aid, and the Manager of Victim Services are able to attend. Michelle?
Here. So I think I'm okay with that list of presenters. And then bearing in mind if there's additional questions to the minister after we have that session, if we can keep it open to put that invite out after Friday's session if we feel it's required.
Okay. We'll maybe have a little section after they leave to discuss about how we'd like to proceed and if there's questions to the minister at that time. So we will go ahead with that meeting. Okay. Thanks, everybody. Any new business at this time? Business? Okay. Thanks for this meeting, everybody. Can I get a motion to adjourn? Zach Bell. This meeting is adjourned. Thank you.